Yeah, thank you, Dr. Stanley, for that very intensive presentation. And we are reminding the audience to send in your questions through the chat box, and time permitting, we will get back to you. Dr. Stanley, do join us for the Q&A section after the next presentation from Viji. So please stay. So let me introduce Viji, our next speaker. Viji Venkatesh brings 36 years of professional experience in cancer patient care and support to her role as region head of India and South Asia at the Max Foundation. She began with the Max Foundation in 2002, leading the administration of international patient assistance programs in Asia. She has also developed the Friends of Max Patient Support Group in India, which has over 250 core group volunteer leaders representing over 18,000 members in more than 20 local chapters in India. Viji has served in numerous community leadership roles in cancer care, including as Asia coordinator for the UICC, or the International Union Against Cancer. She is a trustee of the Being Human, the Salman Khan Foundation, and managing trustee of the Friends of Max Charitable Trust. She also created the Chai for Cancer fundraising and awareness initiative and wrote a book for children called Maximo and the Big C. So VG, for your presentation, and afterwards, please have a fireside chat with me after. So over to you, VG.
Thank you. Thank you, Rod. A joy to have my dear friend and peer of more than 20 years, Rod, as the moderator for this session. And thank you, organizers, for inviting me to present at this prestigious summit. Next slide, please. That's, of course, the title slide. Next one, please. When Novartis Glivec burst upon the firmament of cancer therapy, a hitherto rare and fatal leukemia was converted into a chronic manageable condition. The access program that Novartis put in place and handed over to the Max Foundation for management was one without any kind of precedent. Within no time, we had enrolled hundreds of CML patients into the program, coming from all socioeconomic strata, all age groups. Next slide, please. These were men, women, young adults, and children who were told that they had to be on lifelong treatment. In other words, live with their cancer. And unless they took their medication every single day of their life would be in danger. Given the challenges, long-term side effects, the emotional trauma, impact of various other cultural factors, compliance was going to be a big issue. Next slide, please. While we did find quite a few of our patients able to develop very good adherence habits, attributing this to support from caregivers and their own awareness levels being very high, we found many patients falling off our radar and physicians reporting very poor compliance levels. The reason, as you can see, next slide, please. The reason, as you can see in this slide, were many and varied depending upon the patient profile. Very early in the program itself, it was evident, next slide, please, that these patients and their families needed to have access to some sort of a safe and secure platform to share and learn from one another and maximize the impact of our interventions. And so was born Friends of Max 20 years ago to the day, the support group arm in India of the Max Foundation. Many other support groups followed later in the region, seeing how well Friends of Max was able to bring together patients and their caregivers. Rod, who is the president of Touched by Max in Philippines, Max Family in Malaysia, Max Smiles in Thailand, and Max Vida in Chile, to name a few. Next slide, please. The only way of bringing everyone together was by organizing support group meetings, different kinds of support group meetings involving patients, their caregivers, their physicians. Now, this has never been a very popular concept in this part of the world. Cancer still carrying a lot of stigma, and patients and their families unwilling to put themselves in any kind of spotlight, fearing discrimination of the greatest and at all levels, at home, community, schools, and workplaces. Next slide, please. So over the years, these patient support group meetings took on various formats, but the objective was only one: disease information and importance of compliance. Outreach and compliance, the cornerstones of everything we set to do, reaching out to patients in as many cities and towns as possible. And throughout the length and breadth, if you move on to the next slide, please, you will see the process, how we set this up. We learned to use technology. A lot of speakers before me have been talking about the pros and cons of technology, but we learned to use technology and recognize the power of social media, providing this platform to patients, increasing their attendance, interacting freely with their physicians was really something special that we were able to give to these patients. We owe a lot to our physicians, to the treating institutions for their support in organizing these meetings. And of course, as you will see in the next slide, compliance became really the most important, let me say, priority for us, because there was an unmistakable need, and we found in patient support groups the perfect vehicle. Reaching out to those who couldn't attend these meetings, we realized that if we devised a simple survey that the patients could fill in, this was really something. Being self-reported, it had its own challenges, but at least, it introduced patients to the concept of a good adherence behavior and the importance. And of course, the points here that we've mentioned, in the outcome. If I can have the next slide, please. Now, what were our key performance indicators? Number of cities that we covered, number of meetings held in each periodically, number of patients and caregivers who attended every meeting, the different kinds of workshops we conducted, and of course, the results of the compliance survey. Next slide, please. These meetings in cities distributed throughout the country covered a large number of patients and their caregivers. In fact, at every meeting, we have found more and more first-timers joining us, and the presence of older patients is very encouraging and helps us break the ice. Next slide, please. As a result of encouragement and support of the treating physicians, positive feedback, increased awareness, and application of technology through social media, the website, and WhatsApp groups, we have been able, there's really been a very encouraging increase in the number of participants, as this cumulative graph will show from. We began our meetings in a very spontaneous, natural way. We found out that we had patients with us and they were exposed to this really new concept of living with their cancer. And from 2010 onwards, even though our first meeting was held in 2002-03, but we started collecting data from 2010 onwards, and we honestly I shouldn't say we were surprised. We were happy that when we found more and more, not just patients themselves, but their caregivers, because we know for good compliance how important it is to have the support of a family member. And this really, in fact, the last meeting we had in Patna just last week, a city in the north of India, we had more than 250 people who came to attend this meeting. So from the beginning, when we started, say 21 years ago, till today, the energy, the enthusiasm, everything is absolutely on track. Next slide, please. Workshops are need-based and planned accordingly, interactive, it creates bonding, and it breaks preconceived notions. Participants are divided into groups via their colored name cards. Each group chooses a leader, is given time to discuss the topic that's given to them, and present on different aspects of compliance. Next slide, please. This is a graph I'm really very proud of. It shows what we ask in our survey, a very basic, very simple question. In fact, I have a copy of the survey right here with me. It's how regular are you? Do you miss a dose? How many doses in a month do you miss? And very simple answers. Yes, like I said before, it is self-reported, but when we meet face-to-face with the patients and we sit with them and we explain to them what the survey is and what is the information we need from them, it is really very, very gratifying. And as you can see, till Now, I've given you this graph where 2005, like 5-year gap between each of these studies. It's 1%, just over 1% of the patients that we are interacting with whom we have our interventions, are still non-compliant. Of course, when you talk of 13,000, 14,000 patients, then that 1.40% should not be there. So then in terms of numbers, it's a lot of patients. So my team and I, we have maybe another year or another couple of years work left. Maybe 5 years from now, when one of my colleagues will present this, we might find 100% compliance. My next slide, please. Our key learnings and our interventions. What we have to remember is not compliance, not just with the accepted given, but with the fact that these are patients on lifelong treatment. We're looking at how these patients are aging. And so that really brings in a very complex situation. Our interventions have to be sustained. They have to be creative. It's an ongoing project. So many related factors that can bring in a real need for our interventions to be more and more creative, be more and more accepting of the ground reality. Now, in these two photographs, the little girl is Soni, and she is from Patna. And the first photograph, she's in her mother's arms, her treating physician next to her. She was like, I think 18 months when she was diagnosed. And the photograph down below that is Soni. She is now 9 years old. I met her last week at a meeting in Patna. She needs a different kind of care, different kind of counseling. In the same way, we have patients who come from various backgrounds, all kinds of age groups. And this, like I said, is an ongoing mission for us. And I would like to stop my presentation. I know that Rod and I have a little chat together and question and answers after that. So thank you so much. And I wish to acknowledge the support of my colleagues Sudha and Priyanka, who helped me with these slides. And Reem, thank you so much for the wonderful and patient guidance. It's meant a lot. Thank you. Thank you, Rod. Thank you.
Thank you, Viji, for sharing your years of experience on patient advocacy. As an advocate myself, I found your presentation very inspiring, especially if it has positive results. And while you have invited me for the fireside chat, may I invite also Dr. Stanley to join us. Again, we remind the audience to send in your questions through the chat box. Dr. Stanley and Viji, I would have wanted this fireside chat to be under a mango tree, but for now we have to make do with this virtual setting. Maybe next year we'll meet face to face. First question is for you, Viji. What were the key challenges and roadblocks, and how did you get over them through the years?
One of the main challenges is the stigma that is still attached to cancer. We found it very difficult to initially bring patients to the platform. There were a lot of misconceptions, a lot of doubts. Because of discrimination, like I said in my slides also, we had to really work very hard. And for that, we took a lot of help from our treating physicians. Believe me, our physician partners, without them, we really couldn't be doing anything. And they put themselves out. They would give their time, they would give their energies, they would give their guidance. We have 12 of the best medical oncologists in the country who are on the medical board of the Friends of Max. And I think that helps us a lot, but it continues to be a challenge. And I have seen more educated, the more mental blocks. The second challenge would be the patient profile, patients coming in from distant rural villages, areas without where communication can be a challenge, no access to technology, no access to internet. Their telephone numbers, the only way we can be in touch with them is through their phones, and they will change their phone number because they might go in for a plan that is cheaper, and they will not let us know that they've changed their phone number. And we have found that loss to contact being a very, very severe challenge to us. I mean, from 1 to 10, these would be my main challenges in any patient intervention.
Yeah, I can understand because India is such a big country. The Philippines, not a big country, but we are made up of many islands, so we have the same problem. So how did you came to manage that if patients are out of reach because of changing cell phone numbers?
Trying to make contact with any point of contact the patients would have. Like we developed a very strong relationship, not just with the physicians in the treating institutions, but in the clinical coordinators, the assistants to the physicians. And we kind of tell them how desperate we were. And we have dispensation outlets from where the patients go and collect the medication. So my team is constantly calling them and telling them, when this patient comes to you, please make sure that you give us his or her latest phone number. It's, like you say, that it takes a village to do something. And here we depend a lot, not just on our capabilities, but on the support we get from our physician partners, their clinical coordinators, and our dispensation centers. It's an ongoing process. And of course, training the physicians. And let me tell you this also, the Max Foundation team here gets immense support from the city chapter leaders of Friends of Max. These are aware, extremely emphatic, extremely enthusiastic patients themselves who make that big effort to convey to patients how important it is to be in touch with the Max Foundation team.
Got that. Okay. I have to set aside my questions to Dr. Stanley because we have a question from the audience, Dr. Stanley, and they are first in lineup. Um, would you what advice would you give to patients when approaching a virtual appointment? And how can patients ensure that they make the most of these appointments?
Um, I think from the from the patient side, the patient should use they should I think they should get the information from the reputable websites, also from the reputable doctors, because there are a lot of misinformation, disinformation spread out on the TikTok, like in the video or in a text format. But the patient will always have to keep in mind that not every information on the internet is correct. Even a lot of people talk about it. A lot of people believe this. Your neighbor recommended it. There is still a lot of challenge, a lot of barriers. But sometimes I feel like it's a little bit unfair to the patient because some people, they are just not capable of picking up the information. So I think the government, the policymakers, they also should take some. They should also help the patient to clean up the online information, to set up the standard, to find out, to figure out the qualified contents, to invite the reputable doctors, invite reputable hospitals to create contents on purpose and spread out. So I think the government should take more responsibilities instead of just educate the patient. What's the second question?
No, it's related. How can patients ensure that they make the most of these appointments?
You mean the?
I think it's about the telemedicine.
Okay. So the question is about the patient make online reservation, something.
Yeah. And knowing they have very little time, so with the doctor, how can they make the most out of that very little time?
Yeah. So we actually we are different with the hospital system. The hospital system will need appointments, reservation, but in China, in the public hospitals, which is takes most percentage of hospitals in China, we don't need make appointments.
Mm-hmm.
You can just walk in the hospital and to see the doctor, especially in the urban cities in Beijing and Shanghai. It could be a little bit difficult because you have to wait for up to 2 hours, 3 hours to see the doctor. But usually you don't have to make appointments, or it's a very procedure to make appointments. You can just log on their WeChat public accounts and pick up a date. So basically, it's very in China, it's much easier to see the doctor. So that would be not a challenge to us.
Okay.
And in terms of the online consultation, I think every player in China is trying to provide a much quicker, much convenient way. You don't have to make appointments. You just log on the WeChat and wait for 10 minutes, and doctor will give you the answers.
Mm-hmm. Do you we know that telemedicine was basically invented because of COVID, because of the pandemic. So after the pandemic is totally gone, do you think telemedicine will cease to exist, or will it still be there?
Yeah, during the COVID outbreak, we do see a huge jump, a huge curve, growing curve in terms of telemedicine. So our online consultation has been doubled, tripled, even maybe 4 or 5 times, much bigger than before. But after the COVID, I think the hospital and clinics reopened because during the COVID outbreak, a lot of hospitals and the clinics were shut down, and patients they have no choices; they have to go online to seek for help. And after the COVID, the hospitals and clinics reopened, so we do see a decrease in terms of online consultation. But I think COVID and telemedicine educate the market and bring people more opportunities and more choices. So some people are still very comfortable with online consultation. When they get sick or disease, they still go to the online part because it is convenient, and especially during the midnight. And also another group of consumers, they don't have disease, but they do have some concerns or worries in their daily life. They cannot go to the hospitals to wait for 1 hour, 2 hours, even without appointments. So they can still choose online consultation as a solution provider.
Okay.
Yes.
Viji, you will conclude the session, but first I have to ask Dr. Stanley again. On the average, do doctors spend more time with patients on telemedicine or face to face? And why do you think it is such? Whatever is your response.
I think the doctor's working time will be mostly face-to-face engagement with the patient. So from their working time, say from 8 a.m. to 6 p.m., most of their job will be face-to-face engagement. And after the 6 p.m., from our limited experiences, many doctors will go online to provide online consultations.
No, what I mean is from the patient perspective, which is longer in terms of in an interactive manner, a face-to-face with the doctor or an online telemedicine meeting with the doctor?
It's difficult to say. I think the offline face-to-face communication will be limited to 3 to 5 minutes.
Mm-hmm.
But most players, providers online will also provide very brief answers. So that could be much shorter, like 30 seconds. But from our platform, we are not allowed this happen. We will ask 5 to 10 minutes and even up to 20 minutes engagement with the patient.
Okay, thank you. And VG, to close the session, from your experience as a long time advocate, what could be the key takeaways for patient organizations like us in terms of health literacy development?
You can never do enough, is what we have learned. Year after year, we have learned that at the end of the year, we're like, oh, we did this, we had this project, we completed this particular intervention. But then we always realize that every meeting, even if it's the patient who has attended a previous meeting, every time a patient or a caregiver comes to attend any access related program, it's like a new meeting all over again. There are so many questions, and we have seen, I will repeat myself, the given changes, and we have to keep thinking of creative ways to address those causative factors and make sure that we are aligned with what the patient needs. I think our guidelines should be very simple, should be very basic. If it benefits the patient, it is the right guideline. That is the only marker I keep for myself. If it benefits the patient, it's a good guideline to follow. More than that, our work never stops. It really never stops because a patient's need never becomes less. So we keep on, we march on.
I could not have said it better. You hit it right on the head. Our job is never over. So thank you, Viji. Thank you, Dr. Stanley, for sharing your thoughts in this fireside chat, and hope to see you again in the near future.
Thank you.
Thank
Thank you,
you,
everybody.
guys.
Thank you, Rod. Thank you.